Today we're going to fix the hammer toe deformity, and it's radiographically there's some joint narrowing of the proximal and distal interphalangeal joints. So we'll be doing an arthroplasty and digital fusion of the fourth toe, the proximal joint, and an arthroplasty of the second and third toes of the distal joint. Today we're going to fix the hammer toe deformity on this fourth digit. You can see the toe has a little flexion contracture to it. It's also elevated, so we'll be fixing the flexion contracture with a digifuse implant that will maintain the toe in a rectus alignment and won't let any additional deformities occur in it. And we're also going to lengthen this tendon to get the toe back into position. So after these toes are corrected, the toes are going to be straight, much more cosmetically pleasing, and not painful. The deformity is a flexion deformity. This toe rubs against her shoes. She can't wear any nice shoes. It keeps someone who's interested in wearing nice shoes from being comfortable. So the procedure is really designed to take the pressure off of the joint and to straighten the toe, which corrects the deformity and allows people to wear shoes that are comfortable to them without irritation. And as you can see, there's these little round areas that are thickened skin that form because of the contracture. So the procedure is designed to lock the toe straight with a little digifuse implant and take away the pressure point. The extensor tendon is identified through a stab incision, and we're going to do a tenotomy on this tendon so that we'll be able to bring the toe into a better position. And now the toe is in a much improved position. It's not elevated above this toe anymore. Perfect. The joint is exposed by releasing the extensor tendon and the collateral ligaments, and now the joint is exposed. Since the digifuse implant is cannulated, we first put a cannulated wire into the proximal phalanx. You see? Okay, so once the wire is in place, we go ahead and take an intraoperative image of it. Make sure that it's right down the middle of the proximal. Make sure that it's right down the middle of the proximal phalanx and not into the metatarsal phalangeal joint. And once we have that, then we go ahead and thread the digifuse implant over that. So the middle phalanx is prepped with the proximal phalanx held out of the way. Another 10-degree angled implant is then threaded over the wire, put into place. That's perfect. And the retraction right here. So the implant's in place. As you can see, it's got good bone coaptation. The toe's a nice rectus alignment, and we're going to close the extensor tendon over the joint, and then we'll close up the skin. And let me have this extensor tendon. So now that's with the implant in there, and then we'll close up the skin. Looks fantastic. And as you can see, after putting the implant in, the toe's in a rectus alignment, and there's no external pins sticking out, so there's no unsightly pins, and within 5 days you're able to get this wet, take a shower, and bathe normally. If there was a pin sticking out, most likely you'd have to keep that dry for 4 to 6 weeks. So this is a much improvement. This is a greater improvement on a procedure that we've been doing for many years, and we've improved it so that now it fits into a much improved way of life with this procedure, since you're able to get the foot wet much sooner after the surgery. The final product with the toe sutured, nice rectus alignment, and if you remember, the extensor tendon was tight back here, which made this toe made it elevated above this one, where the shoe would rub against the toe. Now the toe is straight, and it's at the same level as these the second and third toes. So the procedure was a success. We accomplished what we wanted to. The digital implant called the Digifuse is within the toe, contained within the toe itself, and is actually helping the bone heal as we speak.